What if I told you that something as simple as waking up with a puffy face could be your body's final warning before organ failure? Before a life-threatening allergic reaction shuts down your airway in minutes? Before an infection silently spreads to your brain? Most people dismiss facial swelling. They think it's just a bad night's sleep. They think it'll go away on its own. And for some, it does. But for thousands of people every single year, it does not. And by the time they realize how serious it is already too late. I have personally stood in emergency rooms watching patients struggle to breathe, their faces so swollen their eyes were completely shut, all because they ignored a warning sign that started exactly the way yours might have started right now. Stay with me, because what I'm about to share could genuinely save your life or the life of someone you love. Every single second counts. Hello, everyone. I'm Dr. Vanse, and welcome back. Before we get into this critically important topic, if you are new here, this channel is dedicated to giving you real, science-backed medical knowledge that your doctor might not have time to fully explain. So if you want to protect yourself and your family with accurate health information, please subscribe right now and hit that bell icon so you never miss a video. It genuinely could save a life someday. Now, let's talk about facial swelling, what it really means, and exactly what you must do about it. Facial swelling, medically known as facial edema, occurs when excess fluid accumulates within the soft tissues of your face. Now, this sounds simple, but I want you to understand what that actually means inside your body, because it changes everything about how you respond to it. Your face is made up of multiple layers: skin, subcutaneous fat, muscle, and deeper connective tissue. Running through all of these layers are blood vessels and lymphatic channels. Normally, fluid moves in and out of these vessels in a carefully controlled balance. Proteins in your blood, especially albumin, act like tiny sponges, pulling fluid back into the bloodstream. But when something disrupts that balance, whether it's an allergic reaction flooding your tissues with histamine, an infection triggering inflammation, a failing kidney that can no longer regulate fluid, or a heart that isn't pumping efficiently, fluid leaks out and stays out. It pools. It accumulates. And your face, with its loose, highly vascular connective tissue, is one of the first and most dramatic places to show it. The swelling itself is not the disease. It is your body's alarm system. It is a signal, sometimes urgent, sometimes gentle, but always meaningful. Your job is to learn to read that signal correctly. And that is exactly what we're going to do today. Now let's talk symptoms, but I want to go much deeper than a simple list. I want you to understand what each symptom actually tells us clinically, so you can make informed decisions. The most obvious sign is visible enlargement of the cheeks, eyelids, lips, or the area under the eyes. You might notice you cannot fully close your eyes. Your vision might feel blurred, or you might see slight distortion at the edges. But here's what most people miss. Asymmetric swelling, swelling on only one side of the face, is almost always more alarming than swelling on both sides. Symmetrical morning puffiness often reflects lifestyle factors. Asymmetric swelling often reflects a localized infection, a blocked lymph node, or a dental abscess that is pressing on surrounding tissue. Swollen tissue has a characteristic feel. Patients describe it as skin that feels unusually tight, stretched, or smooth, almost like a water balloon. When you press your finger gently into swollen skin and release it, if the indentation remains for several seconds, that is called pitting edema, and it indicates significant fluid accumulation. This is something you should note and report to your doctor immediately. The nature of pain associated with facial swelling gives us enormous diagnostic clues. A dull, throbbing ache that worsens when you bend forward suggests a sinus infection. Sharp, pulsating pain near a tooth or jaw suggests a dental abscess. Burning or stinging pain that began after eating something new suggests an allergic reaction. Pain-free swelling that developed gradually over weeks can point to thyroid dysfunction or kidney disease. Pain is not just a nuisance, it is data. Learn to describe it precisely. When swollen skin also feels warm to the touch and looks red or inflamed, your body is almost certainly fighting an infection or inflammatory process. The warmth comes from increased blood flow. Your immune system is sending soldiers to the battlefield. This is not always dangerous, but it demands attention. A rapidly spreading redness, particularly one that looks like a web of red streaks extending outward, can indicate cellulitis, a bacterial skin infection that can become life-threatening if bacteria enter the bloodstream. One of the most critical categories of symptoms is functional impairment. Difficulty chewing, speaking clearly, or most dangerously, difficulty swallowing or breathing. The moment swelling begins to affect any of these functions, particularly your airway, you are in potential emergency territory. Your airway is non-negotiable. Even a few millimeters of swelling inside the throat can cut off your air supply. I need you to stop everything you are doing and commit these to memory. These are not suggestions. These are the signs that mean call 911, go to the emergency room immediately. Do not wait, do not sleep on it, do not look it up tomorrow. If facial swelling is accompanied by any difficulty drawing air, whether it feels like tightness in the chest, wheezing when you exhale, or a sensation that your throat is closing, this is anaphylaxis until proven otherwise. Anaphylaxis is a severe whole-body allergic reaction, and it can kill in minutes. Epinephrine, the drug in an EpiPen, must be administered immediately. Call emergency services while someone retrieves the EpiPen. Do not drive yourself. Angioedema, deep swelling beneath the skin surface, can cause the lips and tongue to swell dramatically within minutes. If you can feel or see your tongue swelling, your airway is being compromised from the inside. This is terrifyingly fast and terrifyingly dangerous. You need emergency airway management that only a hospital can provide. These neurological symptoms alongside facial swelling can indicate that your blood pressure has dropped dangerously, a classic sign of anaphylactic shock, or that an infection has spread to your brain, causing meningitis or encephalitis. Either scenario is life-threatening and minutes matter. A fever above 101 degrees Fahrenheit 38.3 degrees Celsius combined with a rapidly spreading red, hot, painful area on the face is the hallmark of cellulitis or, in the most severe cases, necrotizing fasciitis, sometimes called flesh-eating bacteria. If you see red streaks extending outward from the swollen area, bacteria may be traveling through your lymphatic system toward your bloodstream. Sepsis, blood poisoning, can follow within hours. Hives that accompany facial swelling indicate a systemic allergic reaction. Even if you feel relatively okay right now, systemic reactions can escalate rapidly and unpredictably. What starts as hives can evolve into anaphylaxis without further warning. Please. If you experience any of these 5 warning signs alongside facial swelling, do not hesitate. Do not Google it. Do not wait and see. Call for emergency help immediately. The few minutes you spend waiting could cost you everything. Now let's explore the causes of facial swelling in real clinical depth, because understanding the why is what allows you and your doctor to find the right treatment. Allergies are among the most common and most dramatic causes of facial swelling. When your immune system encounters a trigger, food proteins like peanuts, tree nuts, shellfish, dairy or eggs, insect venom from a bee or wasp sting, latex, certain medications, it releases massive amounts of histamine and other inflammatory chemicals. These chemicals cause blood vessels to dilate and leak fluid into surrounding tissues at an extraordinary rate. The reaction can begin within seconds to minutes of exposure. Food allergies, drug allergies, and insect sting allergies are the most common culprits in severe reactions. If you have a known allergy, always carry your prescribed epinephrine auto-injector. And if you discover a new food trigger, report it to your allergist for formal testing. Infections are responsible for a significant portion of facial swelling cases, and they range from bothersome to life-threatening. Dental abscesses, pockets of pus forming at the root of an infected tooth, are one of the most underestimated causes. Left untreated, the infection can spread through the jaw into the deep spaces of the neck, causing a condition called Ludwig's angina, which can compress the airway and is potentially fatal. Sinus infections, sinusitis, cause swelling and pressure in the cheeks and around the eyes as inflamed sinus passages fill with mucus and infected fluid. Cellulitis of the face, as we discussed, is a rapidly spreading bacterial infection of the skin. And parotitis, infection of the parotid salivary gland, causes dramatic one-sided jaw and cheek swelling that can be mistaken for mumps. Any physical trauma to the face triggers the inflammatory cascade, blunt force injuries, fractures, burns, insect bites and stings, animal bites, or post-surgical swelling following dental work, rhinoplasty, or other facial procedures. Swelling after injury is a normal and actually beneficial response. It brings healing resources to the damaged area. However, swelling that worsens dramatically after 24 to 48 hours becomes associated with fever, or does not begin to improve within a week warrants medical evaluation. This is the category that most people miss entirely, and it is critically important. Several serious medical conditions affecting internal organs manifest as facial swelling. Kidney disease and nephrotic syndrome. When kidneys fail to retain albumin, the protein that holds fluid in the bloodstream, fluid leaks into tissues. The face, especially the area around the eyes, typically swells noticeably first thing in the morning. Heart failure. A weakened heart struggles to pump blood efficiently, causing fluid to back up and accumulate in tissues, including the face. This often coexists with swelling in the ankles and legs. Hypothyroidism. An underactive thyroid gland produces insufficient thyroid hormone, causing a specific type of swelling called myxedema. This produces a puffy, doughy quality to the face, particularly around the eyes and cheeks, and is often accompanied by fatigue, unexplained weight gain, and cold intolerance. Cushing's syndrome. Excess cortisol, whether from a medication like prednisone or from a tumor, produces the classic moon face appearance, a rounded, swollen face that can be quite striking. Certain medications are notorious for causing facial swelling as a side effect. Corticosteroids like prednisone cause fluid retention and the characteristic moon face with long-term use. ACE inhibitors, a common class of blood pressure medications, can cause angioedema, sometimes even years after a patient begins taking them. Nonsteroidal anti-inflammatory drugs like aspirin and ibuprofen can trigger allergic-type swelling in susceptible individuals. Calcium channel blockers can cause facial flushing and puffiness. Always review your medication list with your doctor if you develop unexplained swelling. A simple medication adjustment can sometimes resolve the problem entirely. Not all facial swelling indicates disease. High sodium intake causes your body to retain water. The salt acts as a sponge, pulling fluid into your tissues. Alcohol dilates blood vessels and disrupts normal fluid regulation. Poor sleep, particularly sleeping face down with your face pressed into a pillow, can cause morning puffiness due to gravity-related fluid pooling. Dehydration, counterintuitively, can cause the body to retain fluid as a protective mechanism. Addressing lifestyle factors is often the quickest and most empowering way to reduce non-pathological facial swelling. Treatment for facial swelling is never one size fits all. It must be matched precisely to the underlying cause. Let me walk you through what modern medicine offers for each major category. Epinephrine is the only first-line treatment for anaphylaxis. It is administered via auto-injector into the outer thigh and works within minutes to reverse airway swelling, raise blood pressure, and counteract histamine. After epinephrine, patients must still go to the emergency room, because anaphylaxis can have a biphasic reaction, a second wave of symptoms occurring hours later. In the hospital, additional treatments include intravenous antihistamines, corticosteroids, and oxygen therapy. If the airway is already compromised, emergency intubation or surgical airway access may be required. Bacterial infections require antibiotics, prescribed by a physician after assessment of the infection's location, severity, and likely causative organism. Dental abscesses typically require drainage by a dentist or oral surgeon in addition to antibiotics. Mild to moderate cellulitis may be treated with oral antibiotics, while severe cellulitis or infections spreading rapidly require intravenous antibiotics in a hospital setting. Sinus infections may resolve with saline rinses, decongestants, and thyme, or may require antibiotics if caused by bacteria and not clearing on their own. Ice packs applied to the affected area for 15 to 20 minutes at a time can help manage swelling and pain during treatment. Do not apply ice directly to skin, wrap it in a cloth. For injuries, the Rice method is a useful starting framework. Rest, ice, compression if anatomically appropriate, and elevation. Keeping your head elevated reduces fluid pooling. Over-the-counter pain relievers like acetaminophen can help with pain, but avoid ibuprofen in the first 24 hours after injury as it may theoretically affect clotting. Surgical trauma and facial procedure swelling generally resolve within 1 to 3 weeks. Arnica gel, applied topically, has some evidence supporting faster resolution of bruising and swelling after surgery. When facial swelling stems from kidney disease, heart failure, or thyroid dysfunction, treating the underlying condition is the only effective approach. For kidney disease, this may involve dietary changes, diuretics to remove excess fluid, and in severe cases dialysis. For heart failure, medications including diuretics, ACE inhibitors, beta blockers, and in some cases device therapy are used. For hypothyroidism, synthetic thyroid hormone replacement therapy is highly effective. Most patients see dramatic improvement in their swelling within weeks of starting treatment. If allergies are your trigger, working with an allergist is essential. Skin prick testing and blood testing can identify specific triggers. Avoidance strategies, medical alert identification, and carrying emergency epinephrine are the cornerstones of management. For appropriate candidates, allergen immunotherapy, gradually exposing the immune system to increasing doses of the allergen, can significantly reduce sensitivity over time. For lifestyle-related swelling, reduce sodium intake to under 2,300 milligrams per day. This means cooking at home more often and reading food labels carefully. Drink adequate water, typically 8 to 10 cups per day, to discourage compensatory fluid retention. Sleep on your back with your head slightly elevated. Limit alcohol consumption. Exercise regularly, as muscle activity assists your lymphatic system in draining excess fluid from tissues. If you sleep on your stomach, a contoured pillow or a dedicated sleep position pillow can make a surprising difference. Outside of the emergency warning signs we covered, you should schedule a prompt appointment with your physician if facial swelling is persistent, lasting more than a week without an obvious cause, recurrent, happening repeatedly for no clear reason, progressive, gradually worsening over days to weeks, or associated with other symptoms like unexplained weight gain, extreme fatigue, hair loss, or changes in urination frequency. Your doctor will take a thorough history, perform a physical examination, and may order blood tests evaluating kidney function, thyroid levels, albumin, and inflammatory markers. Imaging such as ultrasound or CT scanning may be used to evaluate for deep infections, masses, or lymph node abnormalities. Do not attempt to self-diagnose or self-medicate facial swelling that is persistent or recurring. The causes are genuinely diverse, and the right treatment requires an accurate diagnosis. Facial swelling is one of those symptoms that sits at a dangerous intersection. Common enough that most people ignore it, but serious enough that ignoring it can cost you your life. Today we covered what facial swelling actually is inside your body, how to read the symptoms correctly, the 5 emergency warning signs that require immediate action, the full spectrum of causes from lifestyle to life-threatening disease, and the treatment approaches that actually work. I hope this video gave you real, actionable knowledge. Not fear, but empowerment. Knowledge is the best medicine I can offer you. Now, I need to ask you something important. If this video gave you valuable information, please take 3 seconds and subscribe to this channel right now, and click that bell icon so you are notified every time I post. This channel exists to give you medical knowledge that is clear, accurate, and potentially life-saving. Every subscriber helps this information reach more people who need it. And I want to hear from you in the comments below. Has this ever happened to you or someone you love? What was the cause? Drop your experience in the comments. Your story might help someone else recognize a warning sign they would have otherwise missed. And tell me what medical topic you want me to cover next. I read every single comment, and your suggestions directly shape what I make. I'll see you in the next video. Stay informed. Stay safe. And remember, your body speaks. Learn to listen to it.